everybody, I'm Dr. Sunanda Chava. I'm a oral medicine specialist. Well, today I want to talk about Lhermitte sign. So, coming to that, the Lhermitte sign, that's other name for Lhermitte sign is barber chair sign. So, it was first described by Pierre, Marie and Chatelain for the first time in 1917. In 1918, Burial and Davis described in multiple sclerosis. Now, in 1924, Jean Lhermitte, the person whose name has been taken for this sign or given for this name, he was a French neurologist. He published an article on it in 1924. This led to wider knowledge about the phenomenon. So what is Lhermitte sign? It's an electric shock-like or numbness sensation felt on flexing the neck, that is, moving the head towards the chest. So you have other two terminologies called reverse Lhermitte sign and inverse Lhermitte sign. So in the reverse Lhermitte sign, similar sensation will be there on extending the neck backwards. So in Lhermitte sign, when the person moves the head towards the chest, that is bending the head, there will be electric like shock like sensation which will go from spine into the hands, sometimes legs also. So movement of the head down, the sensation towards the legs and limbs, legs and hands, sometimes to the spine also. In the reverse Lhermitte sign, you have the similar sensation, but the head is bent backwards, extended backwards. So this is called as reverse Lhermitte sign. The sensation will be towards going towards the towards the low legs and hands. In inverse Lhermitte sign, the dysthesia will be moving upwards, because on flexing the neck like this, as you see in Lhermitte sign, you move the head towards the chest, the sensation will be going from lower part of the body into the upper part of the body and head. This is called inverse Lhermitte sign. So causes of Lhermitte sign: cervical spondylitis, trauma, multiple sclerosis, systemic lupus erythematosus, pernicious anemia leading to vitamin B12 deficiency, subacute combined degeneration of the cord, that is spinal cord, parasitic invasion of spinal cord, postural puncture headache, chemotherapy when given in high doses, especially in case of cisplatin therapy. So Behçet's disease, herpes zoster infection, disc herniation, transverse myelitis, discontinued therapy with SSRI, spinal cord compression, syringomyelia, arachnoiditis, Arnold-Chiari malformation. Here you have the brainstem, lower part of the brainstem moving, going little bit to a lower level. So this causes Lhermitte sign. So sometimes if you see ependymosa, and cavernous angiomas of spinal cord also can cause this Lhermitte sign. So pathophysiology, exact etiology they have not been able to give the etiology exactly. So they say it probably could be due to demyelination and miscommunication between the nerves, and hyperexcitability of the nerves will cause Lhermitte sign. So nitrous oxide, extrinsic compression of cervical cord, neck collar immobilization causes reverse Lhermitte sign. So diagnosis. The diagnosis of Lhermitte sign is depending upon the disease we suspect. So usually you take a history and then you ask what all symptoms the person has got, and you have to do some clinical examination depending upon the history and symptoms. Also tests, you have to carry out some tests. So blood test to see for inflammatory and infectious diseases, immunological tests like ANA profile to rule out SLE. So CSF spinal tap, cerebrospinal fluid you can draw from the spinal cord. You can do lumbar puncture or a spinal tap you can do. So you can see for protein content and other things. So This will lead to diagnosis of multiple sclerosis and other conditions. So you apply this McDonald's criteria for multiple sclerosis diagnosis depending upon the MRI scan. So how do you manage? It depends upon the cause. Inflammatory, infectious, autoimmune like SLE, multiple sclerosis, SLE and all. So you have to modify the lifestyle. So you can do breathing exercises, stretching, careful posture adjustment and alignment, acupuncture, massage, neck braces, collars, spinal cord stimulation. So how do you do the medical treatment? So you can give anti-seizure medications like gabapentin, pregabalin. You can give tricyclic antidepressants and steroids you can give in inflammatory cases. So this finishes the Lhermitte sign. So I have taken these references, Annals of Indian Academy of Neurology Lhermitte sign, the current status by Dr. Supreet Kare and Dr. Diksha Seth. Overview of Lhermitte sign, Dr. Peter Pressman. Thank you very much. Okay, thank you. Meet you in the next video. Bye.